The agenda is divided into two blocks. First, we will talk about the national hubs, the ERN national coordination hubs, the one in Slovenia and the one on Luxembourg. And then we have some questions and answers on ERN hubs, ERN national coordination hubs. And then we will address the national networks of centers of expertise. So the speakers that we have invited today are Professor Luka Lovresik. She is a clinical geneticist, and a laboratory medical geneticist, and an assistant professor of human genetics at the Clinical Institute for Genomic Medicine at the University Medical Center of Ljubljana from Slovenia. We've also invited from the Luxembourgish ERN Coordination Hub, Aline Bernasola, who is the administrative coordination of the hub. We have also today with us Dan Taysen, who is the director of La Maladie Rare, that's the Rare Disease National Alliance in Luxembourg. Hélène Thioyet, who is the responsible for medical affairs at the French National Alliance, and Laurence Gallou, who is the secretary of the association in France that takes care of PEM diseases. So without further ado now, I'm going to give the floor to Luka, who's our first speaker, and she will be covering the Slovenian ERN coordination hub.
Thank you. So do you take care of the slides?
Yes, I can do that for you, yeah.
Oh, I don't have permission, I guess, right?
No, but no. Do you prefer to share them yourselves, Luka? Yourself?
Your presentation or my presentation? I can share mine. No, but you can. They are only 3 slides, so I'll be happy if you share them. It's okay, since they are already joined, right?
Okay. Yeah. Right.
So in the meantime, I would like to thank the organizers for inviting me to present our experience with the National Hub. It's been a 4 years journey now. As it was said, I come from the University Medical Center Ljubljana, which is the biggest medical center in Slovenia, in the capital. Our facility is a Clinical Institute for Genomic Medicine, and we are basically the main genetic diagnostic unit in our country. So as you are all aware, Slovenia is really a small country with approximately 2 million people. Therefore, we are well aware that we do not have an expertise in all rare diseases in our country, of course. And currently situation is like this, that there are we are full members in 12 ERNs. We are associated members in 5 additional ERNs. And then for the rest, there has been established so-called ERN hub, National Hub, which is another entity in this that is suggested by the Board of Member States. Next, please. So 2 ERNs out of all are only covered by our Institute of Oncology, and all the rest are at our University Medical Center, of course, at different departments, depending on the subject or the thematic area of each of the ERNs. But basically, we all have one general director, and with this in mind, we wanted to make some, let's say, improvements, not only for the ERNs where we don't have associated partnership, but also for those where we have partnerships within the ERNs. Next, please. So we are very, very happy that the director of our Clinical Institute of Genomic Medicine he's Borut Peterlin, and he was actually a member of the Board of Member States when all of these around ERNs started. So we were basically having all the information right at the start. And we were already, let's say, aware right away about the possibilities, which type of memberships there will exist. And already before the first round of call for ERN memberships were put out, he started discussions with our General Director Hospital, and of course also with the Ministry of Health. Next, please. So in this first line, or in the first call, we managed to have only, I don't remember how many, but let's say around 7 to 9 memberships that we became members to the ERNs. And then within the next, let's say, statement that was issued by the Board of Member States, there were an additional possibility of having a national coordination hub. And this was basically meant to be a link with all those networks in which specific member state does not have a healthcare provider already as a member. Namely, with this in mind, next please. For the national hub, it was not mandatory to be a clinical hospital or clinical department. Basically, it could be any type of institution with the appropriate knowledge and the legal and organizational capacity to link the national healthcare system to a number of other, so to all or part or all European reference networks. And this is so-called national coordination hub. So it does not have to be a clinical department, but in our case, it was basically decided to be our Institute of Genomic Medicine. Next, please. Because as such, we were the major, as I mentioned, we are the major diagnostic unit, and we really see the vast majority of RD patients within our clinical genetics counseling sessions, and we do perform most of genetic diagnostics tests for the patients with rare diseases. I'm well aware that not all rare diseases are genetic,
Hey Marco.
Genetic in origin, but
Allora, senti,
yes, some has mic on. Please mute yourself. Some from the Italy, I guess. Somebody. Of course, I'm well aware of the fact that not all diseases, all rare diseases are genetic in origin, but approximately 80% of they are, and therefore confirming diagnosis for all thematic areas. This seemed like a good idea at that point for the Ministry of Health. And next, please. With this in mind, we, let's say, again, lobbied with our National Research Agency and the Ministry of Health to be part of Target Research Program in 2019. I must say that in Slovenia, this is an instrument where, and it's done by joint effort with the National Research Agency and various ministries. And the idea behind this, that this call detects projects with national importance that will support the government and the participating sectors with the strategic development and also policies establishment, therefore improving competitiveness and sustainable development of Slovenia in general. And as we see on the right half part of the slide, it's in Slovenian, but this was basically specifically dedicated for this national hub. Next, please. And we, of course, applied with our main aim to create this national hub, which will deliver a comparable, equal, and accessible treatment and evaluation for those rare disease patients where Slovenia does not have a healthcare provider as a full or associated member to the ERN. And this is also the main aim in general from the European Union, why ERN hub should be established when there in member states there are no partnership with specific ERNs. But in addition to that, as you might remember our situation, most of the ERN coordinators are within our one big hospital. So we wanted to create also some horizontal aims for this national hub. And these are facilitating learning based on good practices across all ERN thematic areas, thereby seeing good practice from one ERN experience and implementing into another ERN at the national level. Also, we see this possibility as a professional networking and dissemination of information between relevant healthcare providers, between relevant departments, between other specialized centers in our country that are seeing on a regular basis patients with rare diseases, not only highly specialized units, but of course also everyday, let's say, medical treatment that they get. And also, very importantly, we wanted to create a network of all key stakeholders in the field of rare diseases and ERNs, including our healthcare insurance, national agency, Ministry of Health, patient associations, and the agency that is related to orphan drugs in our country, and so on. And also, of course, very important as we see it currently, also informing and educating the professional and lay public. Because one of the things that we see that even the professionals within our University Medical Center seeing rare disease patients every day are not aware of all the benefits and pros of ERNs in itself. Next, please. So we were really happy, and our project was very fruitful as we managed to get ourselves, and by ourselves I mean coordination hub, within our national plan for rare disease for the next 10 years. Next, please. And ERN hub is specifically mentioned in 4 activities, and we also managed to get direct finances for our work. And in the minute or two that I have left, I will just go briefly through these instruments that we managed to apply. So in the first activity, there's a Center for Undiagnosed Rare Diseases. As you are probably well aware, there are many patients that don't get final diagnosis on time or are still undiagnosed, but it's clear that they have rare disease. So this center is part of our unit, not national hub, but Clinical Institute of Genomic Medicine, and we are interconnected. And within national plan, this is also meant to be interconnected within the yellow arrow. So we are basically mentioned there, and also this is financed by the Ministry of Health. And next, please. One of the biggest, let's say, success of the 2-year project establishing ERN National Hub is that there's actually a statement in our national plan that based on ERN Hub project results, it was concluded that due to more and more rare disease patients are being discovered and diagnosed, and therefore lack of specialized rare disease outpatient clinics and units, we need to establish specialized teams. And 4 such teams were suggested by our hub and were already put into the financing plan for the next 2 years. They are now in establishment, and they are consisting of 2 medical doctors being aware of rare disease field and patients, 2 registered nurses, administrator, and then clinical psychologist, social worker, and nutritionist. And these are 4 teams in the country. And for the start, we started to actually checking for patient needs. This was our primary aim, at least. So 1 team is based at our institute. And as we are not aware what actually Slovenian patients having lack of, we started interviewing each patient that is evaluated at our clinical genetics evaluation. And these are more than 3,000 to 4,000 per year, so it's a lot. They get 2 questionnaires, one based more or focused on social themes, and one all on nutritional needs and other support mechanisms. And we are now trying to get their feedback to get our specialized teams even better organized. And next, another activity, also part of our national plan, this is specifically for the national hub. So we managed for at least next 2 years get, as I said, 1 MD and 1 administrator to help now actually start working and doing more for our patients in our future years. So for now, it was, I think we are very proud that this need was recognized with our project, that all the national coordinators of different ERNs signed the statement that we need a national coordination for ERNs, that this hub is very much needed, not only for ERNs where we do not have partners, but in general on the national level. And now we are starting further activities to let's say, to get this field even more organized at the national level. And I think with this, I finish, and I thank you all for your attention.
Thanks for that, Luca. I'm not sure if we have any questions on the chat, but I think I'm going to give the floor now to Aline, and then we can take your questions on national hubs after Aline's presentation, if that's okay. Okay. Okay, there we go.
Hello, everybody. So I'm not going to tell you about the history of the ERNs as Luca just did it, but I will just make a short review of the ERN's history in Luxembourg and more particularly in our hospital. The context of Luxembourg is, Luxembourg is a small country, okay, but with about 650,000 people. But the working population doubles daily because of the cross-border who come to work in Luxembourg. And this increases the patient population, even for rare diseases. This is for the context. So our hospital, the Centre Hospitalier de Luxembourg, so CHL, has been endorsed as a hub by the Ministry of Health in September 2019. Then a convention has been signed in order to specify the resources to be made available to make this hub work. By resources, I intend human and material resources, of course. The human resources are one medical coordinator for each ERN, so 23, not full-time, of course. Why 23? Because we have 24 networks in our hospital represented, but one of them, Endo ERN, is a full member, so it's not the same level of involvement in the networks. The others, as the hubs, have the status of affiliated partners. So we have these 23 medical coordinators. We have a general coordinator for the whole hub. Then we have two nurses who are very much involved in patients' pathways. Patients' pathways that have been created or are on their way to be created. This convention signed between our hospital and the ministry is renewed every year. We then signed also other agreements, one per ERNs, which are bilateral cooperation agreements. 1 year later, this was till the beginning, so until September 2019. Then 1 year later, in August 2020, our hub was approved by the EC, so the European Commission, as a hub. The bilateral cooperation agreements specify our commitments to actively collaborate with the ERNs, among other things, in using the tools set up by the EC, CPMS, Clinical Patient Management System, but we'll talk about that later. Then we also are assessed and monitored, of course. There are two ways to do it. The first one is by the Ministry of Health, naturally, who requires an annual report with several KPIs, so key performance indicators. We have to do an annual monitoring required by each ERN. They require some stats, for example, the number of patients, number of new patients, stats on diagnosis, depending on the ERN, of course, and some other information regarding our coordinators' activities and involvement in the networks, of course. So presentations, publications, etc. Yes, thank you. It wasn't. Can you send the previous? Okay, thank you. You can see on the right side of the slide the logo of the PNMR, which is the national plan. We are actually an integral part of the plan as we are funded by the plan. Also, many of our medical coordinators, and obviously all their teams, not only the coordinators, are part of working groups that have been created in the scope of the national plan in the different axes defined by the plan. So next slide, please. Okay, so now quickly some figures to keep in mind to realize the importance of the ERNs in Europe. Maybe these figures may not be up to date as I guess new partners have been joining the networks lately. Next, please. Yes, this small picture is to illustrate the role of the hub, which is right in the middle of the 24 networks. And so we can see the logo of every network, every ERN, and the name of our medical coordinator in our hospital. So now, how does it all work? So how does the hub work with all the ERNs? Next, please. Thank you. So as you probably know, the aim of the ERNs is to make the patient's file instead of the patient cross the borders in order to give to all patients in Europe the same level of expertise in the scope of their rare disease. So you can see a bridge because we can be seen as a bridge between the patients and the European experts. So as I said before, how does it work? Well, in using the tools set up by the EC, more precisely the CPMS, so the Clinical Patient Management System. This is, sorry for that, this is a platform that enables physicians across all Europe to discuss complicated cases in uploading patients' relevant documents in the scope of their rare disease, of course, and in organizing online multidisciplinary meetings between European experts and physicians of our hospital. Next, please. Yes, this is to show you the different way for the patients to get into the loop. So the blue part shows the number of patients currently in follow-up in in the departments of our hospital. The orange part is the number of new patients. This is for 2022. Sorry, I didn't say that. Number of new patients come directly to see the specialists, so in all the departments of our hospital. So they didn't come via the hub, they come directly, whether referred by the doctor or come directly because they have heard about. And then the gray part is the number of patients come via the hub coordination. So the hub coordination is, I mean, the main part of it is via a meeting, a weekly or organized weekly with the ERN Association, and Dan Tyson, who is the director of this association, will talk about ERN much better than I would. These patients are often patients in pain or in huge difficulty, and they may be awaiting a diagnosis to explain their conditions. I now hand over to Dan Tyson, who will talk about ERN. So, as I said, much better than me, and we'll talk about our very fruitful collaboration. Thank you,
Aline. Thank you for that. Dan.
Yes, so a quick introduction into ERN Maladies Rares Luxembourg to illustrate how we as a patient organization work hand in hand with that ERN coordination hub. So a very short history. ERN is a non-for-profit organization founded in 1998. So we're now 25th anniversary today, or this year rather. We represent all rare diseases, and we have an accreditation to act as national alliance. That's what mostly our role, what we are known for at EURORDIS. But what we also have, and that's one of our main activities, is the psychosocial counseling service. So we have a group of social workers and psychologists who work on our team. And as Aline said, we can get advice to patients for free. We can help them with administrative issues around any area of their private life, be that school, social inclusion, work, family life, etc. So we can help them in every aspect of their life. And we actually, can you move on to the next slide, Ines, please? We have quite a lot of requests, and these have been growing incremental over the especially last 5 years, because we had our first national plan on rare diseases that came into place in 2018. And I would argue that from that point on, you have a breaking point in the curve if you exclude 2020, which was the COVID year where we didn't have any increase, but we stabilized with the number of requests. But as you can see, last year in 2022, we had almost 700 requests that were being addressed to us. And so we probably see most of the patients that Aline illustrated on her pie chart from last year, where they either see their specialist first and then come to us, or they start their journey at Alan. And very often when they come to see us, they are already in a quite complicated situation, having tried different things, waiting for their diagnosis, waiting maybe for tests and treatments to be done abroad, because Luxembourg is a small country. We don't have all the expertise in our country, so we have a lot of people crossing the border to get their health care. And the next and final slide gives you an illustration. It's a very busy slide, but it illustrates you how all this fits in the landscape. It's a schematic view. Let's start at the top, where you have the patient who either has or hasn't got yet their diagnosis, and they can either contact the info line, which is on the left, which we also run. So that's a good thing. We have a good coordination between the different layers of support that we can provide. Or it's their medical doctor, their general practitioner, who addresses them to the cellule d'orientation. So the national orientation cell, where we have a psychosocial part and we have the medical part, and they reflect actually, as the color code suggests, Alan on the left-hand side and the Centre Hospitalier, the hospital, on the right-hand side. So you also see on the right-hand side the hub, the coordination hub, and the one full member at the CHL, the endo ERN. And then on the left-hand side, you have Alan, and you see at the intersection, that's what symbolizes our weekly meetings with Aline and a series of medical doctors. That's where we define the health trajectory, if you like. And that's also the entry door to the hub ERN. Yep, that's it. Thank you.
Sorry for that. I was too quick. Thank you for that, Dan. So we have now a little bit of time for questions and answers. I'm not sure if there is anything on the chat. Leni, are you there? You can have.
Yes, I'm here. No, there's so far no questions or comments on the chat.
So then I have one question for Aline and for Luca. So, well, you have both explained very clearly that you're getting your resources and your funding directly from the rare disease plans, your national rare disease plans. So I am assuming that is a big thing. It's kind of the very first step in order to set up something that is formal and recognized and well-resourced. But I was wondering if, after listening to, each of your presentations, the way you are organized is clearly different, but I'm not going to go into that. I was wondering if there is anything that Luca would take from Aline's kind of Luxembourg model, and vice versa, where Aline, whether you've listened to anything that Luca has explained that you would implement at Luxembourg. Luca, you go first.
Okay, thank you. Yes, I think a great thing that inspired me from the Luxembourg part is that they are in essence it's centralized, right? So they as they're one center for everything, they are directly aware of what's going on within different ERNs, let's say from administrative part or from the news part or whatever general changes are being implemented. On the other hand, we have these three types of associations, right? Pool partnerships, associated partnerships, and then there's the national hub. And of course, with respect to patient and CPMS, those partners are making these decisions by themselves, not directly through our national hub. So my biggest, let's say, revelation or information that I will try to now spread in Slovenia at our national meetings is that maybe we could use this organization to support patients more, because the way it is now, we are not so present. Let me explain this. So patients, I think, are not aware of what can we offer to them. We did have, of course, a few patients that we put into the CPMS systems through National Hub. But I think in general, at the national level, not even professionals, let alone lay public, is not aware of possibilities. So this would be our first aim, to make closer connections with the National Patient Organization, which is also one, but it's not so, it doesn't have so good history and doesn't have such a good organization as Alan in Luxembourg. So
Okay.
thank you.
I'm sure you'll find a way, Luca. You'll find a way, and if we can help in any way to make that connection, we're happy to do that. Aline, anything that you would take from the Slovenian model?
I don't know. Maybe what we could improve is maybe more returns of information. I see us as a referring center. Once the patients refer to one specialist, we don't see the patient anymore. This could be maybe we should have returns and a better follow-up of the patients.
When they come back with the advice from the ERN.
Yes, it would be a good thing to have information about that, and to know how the hub
close the loop, let's say, right?
Helps the patients.
Yeah.
Yes,
close the loop.
I think we have to work on this.
Yeah. The other thing that I found very interesting from the Slovenian hub is that the way Luca described their mandate and their objectives, let's say, she did mention education, training, sharing knowledge, and I think that is, in my view, a national an ERN coordination hub should have like two key roles. One is referring patients, and it's a complex one, and the other one is like functioning as a knowledge hub to spread the knowledge that the ERNs are generating or curating, because sometimes they're just curating. So and that is really important, I think, and I like that a lot from the Slovenian model, that they've picked it up from the beginning.
Yes,
and I'm sure it will develop further.
Yes, of course. I didn't talk a lot about the patient's pathway. I just mentioned them because this is totally the nurses of the hub that have developed the pathways. But we have patients' education also that have been set up by them. For different rare diseases, but yes, I just mentioned them without entering without giving details. Yes.
Okay, and I have a question for you, Dan, and I'm sure some people in this call, they have the same question, but they're not going to ask you, but I will. So what would be your advice for a national alliance that wants to kind of get involved and collaborate with a national hub, a national ERN coordination hub? Do you have any specific advice to give?
That's an interesting question. The million dollar question probably. I don't know. I'm looking back at 25 years of Alan experience, and I haven't been there for 25 years. So a lot of people before me did a lot of work in the background and in the past history. I think what our strength is that we have a very good team of social workers and psychologists who are in intimate contact with the medical doctors. They are not shy. They call them, they write emails to them, they go and see them, they accompany patients to some of their medical visits. And I think it's this, probably a reputation that we've built up over the years as a serious partner who have something to add. And of course, as a national alliance, it's probably not the first job you do, and some national alliances don't work according to that model. But we were foremost a counseling service for patients. So this is what got us into the game and keeps us going. And as I said, with Aline and colleagues from the CHL, we have weekly meetings. And I hope we will keep this up, because one main doctor with whom we are in constant contact will retire soon. So we will see how this works, and if this reputation will spill over onto other colleagues who will take the lead then and accept us as full members and talk to us at eyesight.
And it's quite, I mean, even if when you see the numbers, 50 people that have gone through, that mechanism with your weekly meetings is a lot. For these, I mean, when was it? The hub was kind of set up in 2020, right? So I'm assuming that you started operations in 2021. So that's not so long.
Yeah, but even before that, we had some contacts, although they were not formalized as they are right now with the hub. So we didn't start at zero in 2020.
Okay.
Ines?
Yeah.
There are some related questions in the chat.
Yeah, go ahead.
So what is the position and involvement of patient organizations? Are they part of this structure development? And then somebody also wants to know if you have patient representatives in the boards.
I'm not sure what boards we are talking about, but obviously we are not directly on the medical side of each ERN relay at the CHL. That goes through Aline and her team, but we are in contact with Aline, and if there is some news or information that needs to be fed back to us, it will go through her. But we have this indirect contact, I would argue.
I don't think that the hub as such has a board, let's say. I guess that you have a coordination team. It's just 3 persons, right, Aline, in the hub?
Yeah, much more, because yes, there is the medical coordinator of the hub. There are the 23 coordinators, one for each ERN. There are the 2 nurses, and me, of course. Yes.
And what is the governance model? Do they come together at some point?
Sometimes, yes, we have sometimes we organize some meetings.
I guess it's quite informal, let's say. There is not a governance. So
yes, for now, no.
Yeah. This is how things are sometimes. Luca, do you have any governance, kind of formal governance structure of the hub?
For now, not. We plan, of course, to have it because as all national ERN coordinators will be part of it in the future, I think more active role of different departments. So maybe we will have also a board, but I think the main aim would be just to create an alliance directly to patient organizations and to, meet their needs, or at least know what the biggest needs are, and then try to, make better activities with the scope to help patients.
Birke.
My question is in direction of what my question was in the chat, and it was just discussed. But my question is, as far as I know, the national networks will be forced to have sort of national network organization by the EU, and we are in Germany. We are trying to establish a German network of patients, which is quite complicated because we don't have so many representatives, obviously. And I am really surprised that no patients have been involved in the global organization of what you talked about. I'm really surprised because until now I understood that it was nearly the same planned in the national levels that we have on the European level.
So Bibke, you're referring to national networks of centers of expertise, and that we're going to address and cover now. So you will listen now to Hélène and to Laurence, on that. The ERN coordination hubs, there's not really much about how they should look like or how they should organize themselves in the Board of Member States statements. So they, countries are quite flexible, and they can actually, go ahead and organize themselves. The Board of Member States statement just refers to the type of institutions that can be can play this role and what they're supposed to be doing. But in any case, Alain Maladira has been really involved. So maybe Dan, go ahead, please.
Yeah, you talk about the administration and the boards and you're formalizing every collaboration. At this stage, I'm quite happy the way it is, because we are very few people. We have maybe 20 main stakeholders around rare diseases in Luxembourg. And if we have to formalize more stuff, it means that we will meet the same people in different contexts to do more administrative burden. So I would argue at this stage, this works fine as long as it works. And yeah. I'm always a bit skeptical with more administrative load to do what we already do quite well today. But again, this is my personal point of view.
Well, this is why I was talking about different alternatives at the beginning of this session, because national coordination hubs in small countries like Slovenia and Luxembourg, where everyone knows each other, basically, can function in a certain way, and it's going to be very different from national centers, national networks of centers of expertise in countries like Spain or Germany or France, where things will need to be a bit more structured in order to involve everyone, because it doesn't happen that everyone knows each other. So that's why each country really needs to think about the model that they want to implement to interface. There's a dog, Aline, stop. To interface with the ERNs. So now I think I'm going to give the floor to Laurence. I'm going to share my screen again so that she can, let's see. Do you see my screen? Do you see?
Yeah.
Yep.
Yes.
That's it. Good. Okay.
Okay. So.
Okay. Let me see if I can. Okay. No.
Can I start?
Yeah.
Okay.
Hold on a minute. Yeah, you can. Go ahead.
Because I don't need the first one yet. Anyway, it doesn't. Okay. Well,
can you see the first one?
Yeah, but I don't need it right now, but it doesn't matter.
Okay.
Okay. So I'm a patient representative from the Association Pemphigus Pemphigoid France, as well as their EPAG representative for the ERN skin in the autoimmune blistering disease thematic group, the only non-genetic diseases in this ERN. I'm replacing Marie-Claude Boiteux, our EPAG skin coordinator and member of the French Rare Derm network called FIMAHAD. So let me put in context these two terms that we're using a lot, ERNs and EPAGs. As you've heard already, ERNs are European reference networks that were established in 2017. They can be considered as the European version of our national rare disease networks. They are virtual platforms made up of doctors and HCPs, as Aline mentioned before, with CPMSs. The EPAGs are the European patient advocacy groups, the patient counterpart to this European network. In these networks, patients and doctors collaborate. Now, this slide, how can the ERN work be taken and promoted to the national level through the established national patient networks and patient organizations? So for many patients, the ERNs remain a big nebula, and yet work that is done in each one is quite helpful. Each ERN has its EPAG network where we pool, unify, and coordinate our work. This is done in collaboration and joint work with our doctors to propose, promote, and push forward the necessary projects of and for each group. Thus, in the ERN Skin EPAG network, we developed a satisfaction survey to evaluate each patient's consultation with the European Reference Center. At the thematic group level, in my case, the autoimmune blistering disease one, we have developed patient journeys that describe common needs and burdens experienced and felt for each diseases, and it remains a work in progress. These patient journeys are written up by patients in collaboration with their doctors. Doctors only work on the descriptive part of treatments. All the rest concerning symptoms, diagnostic delays and errors, and burdens is dealt with and discussed by patients, and input is given by as many willing patient organizations in Europe as possible. These patient journeys are then organized and written up by the EPAG rep of each thematic group in collaboration with the other European patient organization groups. These are used as tools to inform GPs, dermatologists, rheumatologists, gynecologists, etc., throughout the EU and hopefully nationally as well. The ERN Skin EPAG group has also worked on and written up a common need and burden patient journey. It describes and informs about needs and burdens shared by all the pathologies represented in our 8 thematic groups. Okay, second slide, please. So what work is being done at the national level? The French filières. In France, we're very lucky because thanks to the PNMR, the Plan National des Maladies Rares, or National Plan for Rare Diseases, the first of which was established in 2005, we have been able to set up and consolidate a whole structure of networks. I'll list them first and go over their structures quickly. The Alliance des Maladies Rares, which Hélène will talk to you about shortly. Then the specific rare disease networks called the filières. There are 23 or 24 of them, like FIMARAD in our case, the Rare Derm Network. Coordinate, and also another thing that was established and consolidated, we're coordinating an expert centers. A coordinating center pilots a network of several reference and competence centers spread throughout the country. In dermatology, we have 5 coordinating centers. So the structure of these established national networks have allowed the organization of access to care and expertise for all, and the concentration and consolidation of clinical as well as biological data in health data banks like BAMARA and now the BNDMR, Banque Nationale des Données de Maladies Rares. These are essential for care, prevention, and research. On the other hand, there are some drawbacks regarding the organization of care. In terms of access to diagnosis, the diagnostic odyssey is still too long, requiring continuous efforts of structure, coordination, and communication. And second, in terms of research, and because of the rarity of our diseases, which have required the creation of these databases, national databases should and need to interact with European ones. Hence, the importance or the essential importance and the vital necessity of exchange and sharing of information between national and European networks so that the setting of a European rare disease plan can be achieved. It would coordinate a European strategy on data, expert centers, life and health pathways, and consolidate the synergy between health data, care, and research. Now, how are the French patient organizations involved in the filière and in the national networks? In France, patient organizations are represented and involved in the Alliance des Maladies Rares, and in our case, FIMARAD, the dermatological one. The AMR provides and manages training and information webinars. The information webinars meet once every 3 months and include 2 patient organizations per disease network. The FIMARAD meetings are of 2 kinds. There is a steering committee which meets every 3-4 months, which is made up of doctors and 3 elected patient organizations elected by all the networks of a patient organization. And then second, monthly visio conferences for all the network patient organizations. These meetings are perceived as very rich and valuable because they allow for an exchange of ideas, a collaborative reflection that opens up and breaks the isolation of each patient organization representative, and also because they encourage the sharing of difficulties, the challenges and obstacles experienced by each patient representative in the management of their organization. Now, this collaboration between patient and doctors results in a more effective dissemination of information, since patient representatives pass information back to their own organization and share it through their website, letters, and newsletters. In the specific case of our organization, the Association Pemphigus Pemphigoid France, this close collaboration enabled by our active participation in these networks has resulted in our patient organization signing a conventional agreement with this coordinating expert center. This cooperation allows for a consistent flow of information between our representatives and our doctors, particularly in the area of research and quality of life issues, as we are part of the French autoimmune blistering disease dermatological research group, the Groupe Bulle, which consists of doctors from our coordinating reference and competence centers. And the issues that we're working on now are the therapeutic education of patients, explained or expanded prescriptions and follow-up notebooks, etc. In exchange of this interaction we have with them, we support all these centers in their reaccreditation requests by writing for each one an individual letter of support, which explains and states the particular relationship we've established with each one of them. And we've just had to write about 35 of them this year. So last slide, third slide. In conclusion, it seems that it is this type of collaboration, sharing and exchange that the ERNs aim to achieve, since it is more, since this is one that is more unevenly experienced, all the while striving to reduce diagnostic delays in countries where these types of national networks don't exist yet. And the four major challenges facing this collaborative work are the circulation of information between national networks and ERNs, informing about work being done in each network, national and ERN, feeding back from both entities, avoiding repetitive work is a challenge. The linguistic disparity, English is not a common language shared by all the countries involved, not to mention the problem of countries in which two languages are used or more, like Belgium. And the other issue here is translation, which is also time consuming. The other challenge, which is the lack of volunteers. 90% of us are alone in this and get the job done for the time being, but are exhausted. And the other challenge is the lack of funding. The lack of financial recognition of EPAG work in certain member countries is a problem. In France, for instance, the operating cost of a nonprofit organization are not financed at all, whereas they are in the Netherlands and Germany. It should be pointed out, though, that currently an EU working group is undertaking a project to ensure financial recognition of the work of voluntary patient organizations. So basically, the two biggest challenges remain: first, the flow and sharing of information, because on top of all the other specific works doctors and patient representatives need to do, sharing takes time too, especially when one considers that everything needs to be translated back and forth. And second, the harmonization of all our different health systems, which concerning the care in rare disease makes sense. Thank you.
Voilà, thank you, Laurence. So now over to Lan, who's Lan's maladie rare, the responsible for medical affairs. There you go.
Thank you, Ines. Thank you, Laurence, for your presentation, and we'll continue on the same same topic. So, how are the French filière organizing patient representation? What is interesting is that Laurence has just described the skin filière FIMARAD, so it is one example among the 23 filières that we have in France. They are organized quite similarly as the European networks, with the only specificity is that in France, our filières don't cover the rare cancers. The filières, they have similar missions that are identified in the French national plans. And in France, the patient representation in the governance of the filière is mandatory, as it has been written in the national plan. But the main idea to keep in mind is that the governance in each filière is really heterogeneous among the filières. So we see that, for example, we have a different number of patient representatives in each filière that goes between one patient representative to all the patient organizations that are part of the filière that are involved in the governance. We have different ways of designation of the patient representatives. For example, as Laurence said, in the filière FIMARAD, the patient representatives are elected by all patient organizations of the filière. But in some filières, the patient representative is nominated by the medical coordinator. In some filières, all the patient organizations are in the governance of the filière. So it is really different among every filière. We see that the frequency of governance meeting is different between the filières. We have between 1 meeting per month to 1 or 2 meetings per year. So that's quite different. And the decision processes are quite different also. We see that the patient representatives are included in the decision-making process quite differently among each filière. I have to say that FIMARAD is quite a very good example on the inclusion of patient representatives in the decision process. It's a really good example, but it's not the same in every filière. Next slide, please. So how is Alliance Maladies Rares involved in the French filière? So Alliance Maladies Rares is the French National Alliance for Rare Diseases. So we are an organization that gathers 240 member patient organizations. We as Alliance have 2 main missions. One is to advocate for rare diseases in France, and one is to empower our member organizations. A long-time choice has been made by Alliance Maladies Rares not to substitute, but to support our patient organization members. So that means that Alliance Maladies Rares is not directly involved in each filière, and we are not included in their governance. However, we provide support for the organizations that are in the governance of the filière. And one important point to keep in mind is that Alliance, as a collective, is the main interlocutor for health and research institutions. So that means that we have to communicate both ways between our patient organization members and our institutions. So to support our members to play their role in the governance of the filière, as Laurence has mentioned before, we have set a working group gathering 1 or 2 patient representatives of each filière, member of the governance at best. In some cases, our patient representatives are not yet in the governance, but they are hoping to be. So the participants of this working group are chosen and invited by us to participate. For example, in Laurence's organization, it's Jacques, another fellow volunteer, that is part of this group since the beginning of this group. We have 1 Zoom meeting every 2 months that lasts about 2 to 3 hours. And I have also regular checkups by phone, email, etc., with every one of the patient representatives. Next slide. So what needs are we addressing and how? First of all, what are the needs of our patient organizations member? As I said before, the French filières are very different. So the patient representatives need to share point of views, experiences, and good practices. Also, a lot of actions for the rare disease in France are done by the filière, as it is written in the national plan. So the patient representatives, they need to have validated scientific information on every topic that is part of the national plan, so they can play an active role in the governance. So that's why on our Zoom meetings, we provide them scientific, medical, political information, usually with the participation of a speaker. And we have a lot of Q&A and discussions in the Zoom meetings. Also, our organizations, they need to know what are the latest national strategies that are led by our institutions, and that is the info that we give to them. But also, Alliance Maladies Rares as a collective group has also some needs. So we need to highlight positive actions and good practices so we can transmit them to all of our patient organizations. We need to know better how every action is being tackled by each filière. So there are 23 filières, and that's a lot of actions. And we also need that all patient organizations that are part of Alliance contribute to our advocacy strategy. We really need their input so we can work on our advocacy.
Tony, can you mute yourself? Tony.
It's okay. One of the questions that we had identified with the Ines and the EURORDIS team is how do we identify emerging needs? That is a very good question. So for now, we did 2 surveys to know what work has been done by the filière and how the patient representatives are working in the governance. So we have sent two surveys to all of our patient organizations. We have open discussions during our Zoom meetings with the working group. I also received direct requests and questions from the members of the working group. And also I have a direct link with the filière project manager, so they can also send me some comments and requests. But this way of identifying needs is not sufficient yet, and it's still a work in progress. And I think we need to go further on this. Actually, with this working group and the work of the patient representatives in the governance of the filière, we have currently a lot of challenges. So that's the final slide, our challenges. So we have the challenge of identifying needs. We also have the challenge of checking satisfaction. As of today, the only satisfaction checking that I have is informal discussion with my working group. So that's not enough for now. So we need to define an organized process. The working group is 3 years old, so I have been managed it for 3 years. So we have kind of a long experiment with it. So now we can see what we will do with it in the future. So an organized process of satisfaction will allow us to know how we can make this group evolve in the future. So we have thought of many options. So perhaps a potential dedicated meeting to see, to define together what we will do next. Perhaps some satisfaction surveys as for the webinars. I don't know. It's a work in progress and an open question. Also, with the work done with EURORDIS and the preparation of this webinar, it has become very clear to me that we don't engage enough with the work done at European level. So we should study and replicate perhaps some best practices that on patient engagements that exist at European level. And we need to think about how we can disseminate both ways between France and Europe. And also, as Laurence said just before, one of our main challenges is the lack of time of volunteers and of resources. So it's the same challenge for the EPAGs and for us. Our working group is challenged by the availability of our patient representatives. And the last perspective is how to better communicate both ways between Alliance and our patient organizations. On the one hand, we as Alliance, we need more inputs from them to build the next national plan and to advocate. And on the other hand, they need more information, more training on scientific, medical and political issues, and on the actions led by national plans. So that's also is a work in progress. Thank you, Ines.
Thank you, Hélène, and congrats for that, because yeah, you are doing an incredible job, and it's just you yourself, I think, right, and the team.
Yeah, it's mostly me.
Mostly you. That's a way to put it. Okay. Okay. So now we have some time for questions and answers. I'm going to stop sharing. Is there anything on the chat, Lenya?
No,
Any
there's
questions?
not much more. No.
Okay. So I have a question first of all, for Laurence. So yeah, I'm not sure if you mentioned it during your presentation, but the coordinator of your national network is also the coordinator of the ERN. And I am wondering if, because she's French, and we have lots of French ERN coordinators who are also active in the French filière in the national network. So I'm wondering if you think that Christine has brought into the ERN some things from the national network that we're working, etc. Or if you see lots of difference in the way the ERN is being managed as opposed to the French.
No, of course, having Christine Baudouin as being the same person coordinating the ERN skin, and being the coordinator of FIMARAD, of course, has been very helpful, because and also as a person, she's very receptive and very and extremely encouraging of patient participation, of their input, of their energy. She's really, I mean, and sometimes when we have, I remember an ERN skin meeting with EPAGs, when the EPAGs had to present their, when all the patients had to present their slides or their topic, all the doctors got up and left to go have coffee. And Christine, and Christine was the only one who stayed and was really very unhappy about the attitude of the of her doctor team. So her being the coordinator of both entities has, of course, accelerated work that was able to happen in our ERN. For instance, the work being done in the filière there is work that is done on the education therapeutic program, and that's what was the topic of the 2 scientific days on the 21st and 20th and 21st of April, and it was and that was the theme of those days. It was how to develop that, and because it doesn't exist in an organized way in other European countries. So thanks to this experience within FIMARAD, the ERN skin is going to start working on that. I mean, we have integrated a therapy in my organization. I know that with our diseases, we have already l'éducation thérapeutique des patients, where we're involved, or we have special days where our doctors show us slides and help us to identify the disease and what it means and the treatments and all this. So we have scientific information. But on the other hand, also we also, when patients are in the hospital for a general day consultation with different doctors, they are welcomed by the association, and they get to talk to the organization about their burden. And there is always a nutritionist, psychologist who is there and who welcomes, all their, all their whatever they need to say and all their burdens. So we do have that put in place. We're also working on, as I was saying, also, this is something that we're working as an association, but we're trying to push that to FIMARAD and then maybe elsewhere. It's having, it's at the patient level, having, these prescriptions explained, so you have the prescription written by the doctor, but then the prescription would be given at the same time to the patient, explaining why they need to take those medications, and they can't just stop because it's the weekend or something like that, so there is that, and there's anyway. But again, we can show our example as much, as we want, and ad nauseam, until it isn't a European common will. This will only stay a Franco-French. We will stay within our French boundaries, and our health systems are so different, from each other, that it seems that work really needs to be done more at the level of health organizations and ministries in various countries for all this to really be helpful for the patients, or so that we can reach an equality, some sort of equality in treatment. And we need to harmonize everything, as Hélène was saying too, we need to the information has to flow both ways.
Well, that's one of the before giving the floor to Bitka, she has a question. One thing that I wanted to ask you is, there's lots of EPAC advocates that get questions back home in their own associations, patient organizations, that they don't understand what they're doing in the ERNs, and that they don't get it. And I'm wondering whether having the filière in place has helped you not to, really, to connect both worlds more easily, let's say, even if you might not be aware of that. But that is something that they get a lot. And I get lots of questions about that.
Yeah.
How can I explain back home what's the value of my, dedicating my time to the ERN?
Yeah, but it would be because they think that it has to be, first of all, you have to take care of your own before you take care of everybody else. So I think you have that type of mentality. But then when you tell them, but no, if you have more doctors from different countries collaborating, then it will trickle down on you too. You will get benefits and advantages from that as well. It's not, it's not only the French doctors who know how to cure, even though they might think so.
Thanks for that, Laurence. Wiebke, you have a question?
Yes, thank you. I have two questions. The first is, are the filière similar to the ERN concerning subjects? Do you have the same structure, saying rare liver or skin? It sounds like this, but why is it only 23 but not 24?
Or maybe 24, I don't know, 23, 24, I don't know.
And maybe Hélène, you want to respond to that?
Yes,
it's slightly different. The grouping
yes.
is slightly different in France, and is I think that the reason is because of how their healthcare system is organized. But Hélène, go ahead.
Exactly, it's 23. We don't have the rare cancers, so that's for ERNs that are not as the French filière. And exactly, it's there are a few differences between the filière and the ERNs, and that's historical. It's based on how the French health system was before the filière.
So the French filière came first, and then the ERNs came later. And if I have to say something, I would, if someone wants to set up a network, from scratch, not talking about the filières now, but I would try to do them multidisciplinary rather than single professional ERN networks. So the ERNs are single professional networks. The French filière are single professional networks. Ideally, if possible, they should be multidisciplinary networks with different professionals.
The second question would be, sorry, concerning the patient representatives. As we heard, you have a lack of patients, as everybody has a lack of volunteers. And the idea could be to have a bundle of filière and only one patient representative being involved. Do you think that would be practicable, or would you say it is so different, all these networks are so different that it is not working?
Well, yes. I don't know. It depends. I mean, we are the only non-genetic disease in this filière, for one thing. So that already sets us differently. And the diseases are just so different. I mean, we do manage to. We didn't write a patient journey stating the common needs and the common burden, but basically it's a lack of diagnosis, doctors not hearing us. It's the same thing that you could find. All the same recriminations that you can find across border, but it's not specifically to the disease.
Yeah.
So. Bandage care is not cross out. You can't. It doesn't exist for everyone. For I don't know how that could be.
Hélène, do you have any?
Yes, in other filières, they have to have at least 3 or 4 patient representatives. For example, one is pediatric, another one for adults. Because in the same filière, you can have pediatric and adults, you can have genetic, non-genetic. So it's better if you have at least 2 or 3 patient representatives. But each filière is really different. I think they managed to give the best between
But
the lack of volunteers.
Were you referring to having EPEC advocate and patient representative in the French filière as being the same person, or was not that the question?
Yeah, the question is if you're only we are just thinking about how to organize it in Germany, and as we are at the moment, we are perhaps 15 persons of the whole rare disease area. So we need to have 24, but we ask ourselves if one could bundle it, because you have always the same problems. You've got the pathways and so on, and you could, from my point of view, I'm in the Wilson's disease, but I'm working for the rare liver too, because it's always the same questions. Do they ask me? Do they invite me? How do I make a pathway? It's always the same. And for the details, you could ask others to help you.
No, that makes sense.
Yeah.
It's quite
Yeah.
pragmatic
Yeah.
approach, I would say. And if you don't have the people, I mean, it is something that I think is a good idea. If you don't have enough people, it's always better to have someone covering a couple of things and then going back to it also happens with some EPECs and some ERNs. Okay, and Hélène, just to a question for you. I would say that for the national alliances that are listening to us, I think that in big countries that will go for a national network and that will establish a national network, there is a role for the national alliance to support patient engagement. I've heard you saying very clearly that you decided consciously to not replace patient representatives, but to support them. So that decision in your side means that you're supporting patient organizations that are not part of the National Alliance, that are not members. Is that the case?
Yes, actually, I have in my working group one organization that is not a member of Alliance Maladies Rares for a few reasons, but she is in my working group because she is part of the endo filière. So yes, it is an exception for specifically the governance of the filière. It was really important for Alliance Maladies Rares that the patient organizations were involved in the filière, so it's okay if they're not part of Alliance.
Yeah, same here, but I just wanted to underline that because we have followed the same approach at EURORDIS, and it's working because we couldn't do it otherwise. Okay, so, well, first of all, thank you to, of course, Laurence, Hélène, Luca, Dan, and Aline for preparing their presentations, for sharing all they know and all they don't know also. And to me, it has been, quite an illustrative and rich webinar. So I hope that you have enjoyed and you've learned something. And see you around. Sorry for the technical glitches at the beginning, but this is what happens when you have two screens. So have a nice day, everyone. And I think that, we don't have any, Bibke, are you saying goodbye or you have another question? Goodbye. So, thank you, everyone. We'll keep you posted. There will be more work on these structures in the future, I'm sure. Thank you, everyone. Bye-bye.
Bye-bye.
Thank you.